Hi, Dr. Vikram from Clinic Golden Proportions. I want to discuss a few important aspects of cosmetic surgery. The most important being an information overload. Patients are subject to untold amount of information, and we have information at our fingertips now. But the problem with information is to sift through this information, to select what is good for you, to select what is correct, to select what is not appropriate for you becomes very difficult. Now, when we study during our post-graduation and our undergraduation, we are trained to go through a lot of information, to select information that is good for us, to discard information that may not be relevant, and this is part of our medical training. But sometimes a common person may not be able to have and be able to deal with this excessive load of information, and this gives rise to a lot of doubts in the mind, and this gives rise to two main problems. One, how to select the right procedure for yourself, and two, who should be the ideal surgeon you should select. And again, the procedure that a person selects for themselves has to be absolutely perfect. It should be tailor-made for them, and it should do the work for them. And the difference between good cosmetic surgery and bad cosmetic surgery can be the selection of the procedure that you do. I have patients who come to me and say, "Doctor, I feel this one would do best for me because it worked on somebody else, because one of their friends had got it done, or maybe just because there's one doctor who knows only to do that procedure and he was able to convince his patient for it." And that might not even be the right procedure for that patient. And I've seen those patients go and get those procedures done and suffer for it. And this is a huge problem in the cosmetic field, choosing the right procedure. Of course, the right doctor is always important. I believe I'm the right doctor for my patients. But jokes apart, it's necessary to select the procedure and the doctor who can do it the best. Now, every surgeon cannot do every procedure to perfection. It's up to the surgeon to decide his strengths and his weaknesses, and to clearly tell the patient what his strengths are, and then concentrate on his core strength and do that perfectly for the patient. And therein lies the difficulty that the patient faces. Can he or she find the right procedure for themselves and the right doctor who would do that procedure perfectly?